Vatican says Pope Francis is now in critical condition after a severe asthma attack today. The Pope is entering his second week in a Rome hospital where a respiratory infection led to pneumonia in both lungs. Among the millions of faithful praying for him, the Archbishop of New York.
It's not looking good. I admire his grit. I admire his resilience. I'm praying with him and for him. But I think we have to be realistic, as he certainly is.
Our Stephanie Bennett is live with the latest on his condition. Stephanie.
Hey, John. Yeah, the Vatican says Pope Francis's health has deteriorated over the last 24 hours. And as you mentioned, describing his condition as critical. Now, the Vatican says he suffered a prolonged asthma-like respiratory crisis, and he needed blood transfusions because of a low platelet count associated with anemia. Doctors also had to administer a high flow of oxygen because of his breathing crisis. But he remains alert, though he is more unwell, they say, than yesterday, saying at the moment the prognosis remains guarded. Pope Francis was admitted to Rome's Gemelli Hospital on February 14th. He has since been diagnosed with pneumonia in both lungs, along with bacterial, viral, and fungal infections on top of his chronic bronchitis. Right now, dozens are gathering outside the hospital to pray.
We are here to pray for the Holy Father. We have all come together in a very spontaneous way. Some nuns organized this rosary, but we have all joined in this prayer. I believe that the Pope needs the unity and the prayer of the Church to accompany and support him at this difficult time as well.
And double pneumonia can inflame and scar both lungs, making it difficult to breathe. Of course, the Pope has a history of respiratory illness, having lost part of one lung as a young man and suffering from pneumonia in the past. Doctors have warned that the 88-year-old patient, of course, he is very fragile. For now, we're keeping our eyes on this very closely. Back to you, John. All
right, Stephanie Bennett from London. Stephanie, thank you. For more on the Pope's condition and his outlook, let's bring in Dr. Mark Siegel, Fox News senior medical analyst. It doesn't sound good, Dr. Siegel.
John, it's hard to know exactly how bad it is. You know, his main doctor, Dr. Alfieri, is saying he's guarded. And I want to say one thing that's positive. He's not on a ventilator. He's breathing on his own. He's awake and alert. All of those are good signs. And the fact that he got blood might simply be to improve his oxygen carrying capacity, which you need in a time like this, and they're obviously giving him oxygen. When he had that asthmatic event this morning and they gave him oxygen, they probably also used bronchodilators, which help to open up the lungs. And if you get over that and you're breathing better, that's a good sign. We want to be watching to see how much oxygen he needs, that he remains off the ventilator. Stephanie said, you know, look, he has multiple different bugs. That bothers me. But bilateral pneumonia, it makes it a lot more difficult to recover than one lung. And the fact that he had pneumonia before and that he's lost part of a lung before when he was young means that his lung reserve is less, and he's 88 years old. So there's a lot of things that make this hard to say whether he's going to recover, but the longer he goes and improves, the better off it looks. And again, not on a ventilator, a very good sign.
Yeah, the good news is they say he's in, although he is in critical condition, they say the pain for him is no worse than it was yesterday. But I want to talk about sepsis. His doctors are saying that sepsis is one of the big dangers here. Explain to us how that works, what that's all about.
And that would be the main danger, in my opinion, John. That plus respiratory failure. Is he again, does he continue to breathe on his own without assistance? That's one thing. Sepsis means that whatever the bacteria is gets from the lungs into the bloodstream. When that happens, your blood pressure goes down. You need support to keep your blood pressure up. It gets more and more difficult. You get acidic. Very difficult to recover from that. The fact that he's not septic and not in sepsis and he's stable, vital signs must be stable, in fact, another good sign. They watch for that, but it's good that it hasn't happened yet because a lot of the times it happens early on. If they battle this back with antibiotics and he continues to stay stable, there's a pretty good chance he could still recover.
I had a bout with pneumonia a little more than a year ago. It came with some flu, and it was probably the worst illness I've had in my life, far worse than COVID. It's a very tough condition to get over.
Well, it's also because the lungs sweep themselves out. I want the viewers to imagine the lung is a vacuum cleaning effect. And when you got pneumonia, it's very difficult to get the gunk out of there. And it gets packed in, and it's hard to do that. That's what the nurses do around the clock there. And I guarantee you he's getting the best medical care anywhere in Italy. The nurses don't get enough credit for this, John. Recovery from pneumonia is all about great nursing.
Yeah. Well, we certainly wish him well as he continues to battle this. You mentioned antibiotics, so that suggests that this is not. There are the two kinds of pneumonia, obviously, bacterial and the other type, which the name escapes me right for the moment. But this sounds like it's bacterial.
Viral
pneumonia?
or bacterial?
Viral, correct.
Viral or bacterial, but the way this is with bilateral pneumonias, the way this sounds, I can't prove this, but I believe it's probably bacterial. And one more thing, you use broad spectrum antibiotics. You want to use a shotgun here to get the bacteria. You don't want to be too elegant. So you use broad spectrum antibiotics to cover different possibilities, and that tends to work. That's what I think is going on.
All right, Dr. Mark Siegel, thanks for the explanations. We appreciate it.
We'll be going.